Hi, my name is Bryce. I'm going to be your student nurse today. Can I just verify your name and date of birth?
Hannah Everett, 12/14/04.
Awesome, thank you so much. I'm going to be doing a musculoskeletal assessment today. I'm going to be starting off with a temporal mandibular joint, and then I'm also going to be looking at your cervical spine. It should take me probably about like 5 minutes. If you do have any questions, please stop me or let me know. First, I'm just going to start off with general inspection. I am noticing that the face is symmetrical. I'm not noticing any musculoskeletal or muscle deformities upon initial inspection. If you don't mind, I'm going to have you open your jaw. All right, and you can close it. Was there any pain or anything associated with that? Okay, I'm not noting that there was any muscle deformities upon opening the jaw, and again, no pain or anything associated with that movement. I'm next going to begin with palpation. I'm going to just kind of feel along the jaw. I'm going to start with your mouth closed, and then I'm going to move to it open. Just going to feel around here. And was there any tenderness or anything?
No.
Okay, and if you want to open. All right, and then any tenderness?
Nope.
Okay, so I am noticing that there is muscle development around that region. I am noting that there was no tenderness or anything upon palpation, and I am noting that there was no crepitus. I didn't notice any crackling or sounds or crackling or anything upon opening the jaw, and that there was no swelling in that region as well. Next, I'm going to move into making sure that the temporal mandibular joint has a full range of motion. If you don't mind, I'm going to have you move your jaw side to side for me, kind of lateral movement. Perfect. Any pain or anything? Okay, and then if you want to move your jaw forward and backwards for me. All right, and was there any pain or anything with that either?
No.
Okay, perfect. So I am noting that there was no pain. I didn't hear any crepitus or anything with that movement of the jaw. And I'm going to say that there was a full range of motion. Looked like there was a full range of motion of the temporal mandibular joint. Next, I'm going to move into the cervical spine. Again, I'm going to start off with inspection. I'm noticing that the neck and head is erect, and that is at the midline of the body. And that's just going to kind of move to the backside and take a look at your actual spinous processes here. All right, and then I am noting that there is muscle development upon initial inspection. Next, I'm going to move into palpation. First, going to kind of palpate along the spinous processes here. Let me know if there's any tenderness or anything.
Nope.
All right, and then I'm just going to kind of move around the region. And let me know if any tenderness or anything comes up.
Nope.
Really kind of feeling around the trapezius muscles, and then I also want to kind of get into the sternocleidomastoid area as well. And was there any tenderness or anything?
No.
Okay, so I'm noting that there was no tenderness upon palpation. I'm noting that the spinous processes and the muscles were firm. I am noting that there was there were no spasms, and again, no tenderness to palpation. Next, I'm going to move on to a full range of motion. There were also no muscular deformities upon the palpation of the muscles back there. Next, I'm going to move on to a full range of motion of the cervical spinal region. So if you don't mind, I'm going to have you start off with flexion of the head. That is just going to bringing your chin down to your chest. And then I'm going to have you extend your head, and that's just kind of bringing it back to the midline. And then I'm going to have you hyperflex your head, and that's going to be bringing it all the way back for me. Perfect. And was there any pain or anything?
No.
Okay. Next, I'm going to move into a lateral movement of your head, and I'm just going to have you move your head while maintaining kind of composure of your shoulders, but really making sure that it's just your neck moving. Just want to move your head side to side for me. All right. Any pain or anything?
No.
Okay. And then I'm going to have you do a rotational movement. I'm just going to have you move your head side to side really for me. All right, and any pain or anything? Okay, I am noting that the range of motion was equal bilaterally with no pain or anything associated. Next, I'm going to move into sternocleidomastoid strength. So I'm just going to put my hand on the side of your head. Just going to apply a little bit of pressure. I'm just going to have you kind of push back and just make sure that we have full strength there. All right, I'm going to move on to the other side. All right, and I am noting that there was full strength of the sternocleidomastoid muscle, 5 out of 5 strength bilaterally. And everything that we have done, the range of motion and also the sternocleidomastoid strength, is indicating that the cervical portion of cranial nerve 11 is fully intact.